President Trump sounding hopeful over the Republicans' latest plan to repeal Obamacare.
I think there's tremendous support for it. I think it's actually much better than the previous shot, which was very sadly let down. But again, we've been hearing about repeal and replace for 7 years. They have a chance. I thought that when I won, I would go to the Oval Office, sit down at my desk, and there would be a health care bill on my desk, to be honest. And it hasn't worked out that way. And I think a lot of Republicans are embarrassed by it. But I have to tell you, I think they're going to do a great job. If this happens, it will be a great thing for the country.
Well, the president isn't the only one optimistic. A spokesman for Senate Majority Leader Mitch McConnell says the latest Republican health care bill will be brought to the floor next week. The legislation would repeal central elements of Obamacare. States would get block grants instead. Republicans must vote on the bill by the end of next week or lose access to special budget rules that prevent Democrats from filibustering. In other words, using 50 votes to get it across the finish line. Let's talk about the health care bill and its chances of passing and what else is on the table. South Dakota Senator John Thune is chairman of the Senate Republican Conference, and he joins us from Sioux Falls, South Dakota. Senator, thanks for being here.
Great to be with you. Thanks, Brett.
So where do you see it tonight as this head count continues? It looks like a repeat of where you were before on the skinny bill on the Senate floor that came down to basically John McCain's vote at the end. Aren't you in the same spot?
You were there that night, Brett, as I recall. It's a similar situation. We're a handful of votes short of having the 50 that we need. Senator McConnell has indicated that he's going to put the bill on the floor. I would take that at face value, and I think we're going to be working very hard over the course of the next few days to try and get to 50 so we can get this across the finish line. This is a promise and a commitment we made to the American people. We need to deliver. We know that Obamacare is failing, skyrocketing premiums, fewer choices. We all know the problems with Obamacare, and we need to rescue the American people from what is a system that's not working for them and give them something that's much better and allows states the flexibility to design programs that work for their individual populations. That's really what I think is going to get us the best possible outcome.
So the criticism, let's get into this bill just a little bit. The criticism about the bill is that some states are going to lose out on funding that they have. In other words, they'll get less funding than they currently get on health care. As you look at a map, there are actually a number of states that get a reduction in the billions of dollars for federal funding under this bill. Obviously, some states go up in the pink and red there on the screen. Isn't it going to be hard to convince the states that are losing money that this is somehow a good deal?
Well, I think in the long run, Brett, what you'll see is that this makes some changes and reforms to Medicaid, puts it on a per capita cap basis going forward, increases spending every year on Medicaid, but at a slower rate. And there are states who will, because they didn't expand Medicaid, and this does create parity between non-expansion and expansion states, do better. But I think in the long run, everybody will do better. I think you'll see lower premiums, expanded coverage, because the one thing that happens when states are able to design solutions is they can innovate. We've always talked about states being the laboratories of democracy. If we really want to get solutions that fit the populations in each of the 50 states rather than having a Washington one-size-fits-all solution, then this is the way to go about it. And I think this is a very effective way of delivering health care insurance to people in this country, some who currently don't have it. And I think that the way that in the end you're going to be able to get states on board for this is to help them realize that they're going to have maximum flexibility and that this approach is the one that's going to get the best solution when it comes to covering more people and lowering costs.
So when you hear Democrats say that this is actually worse than the last effort that you all had on the Senate floor, how do you respond?
Well, it's not. I mean, if you look at what this does, of course, it does get rid of the individual mandate, the employer mandates, which are very unpopular. It repeals some taxes. It protects people with pre-existing conditions, but it does distribute power, control, authority, and money out of Washington, D.C. and back to state capitals, where you have governors and state legislators making decisions about how best to provide coverage for people in their individual states. We think this is the correct approach. There's a lot of support for this, and I think the other thing that will change change, hopefully, some people's minds, is there was some concern the last time we went through this about giving Senator Alexander, Senator Murray, in regular order an opportunity to work with Democrats, see if there's a bipartisan path forward. Senator Alexander indicated earlier this week that there's no consensus there. If we're going to do something to repeal and replace Obamacare and address what are all the problems that we know exist with the existing system, I think this is the best path forward. And frankly, as far as I'm concerned, it's consistent with what I believe gets you the best possible outcome and result, and that is 50 states designing programs and solutions that work for their populations rather than having Washington dictate a one-size-fits-all solution from here.
And the Jimmy Kimmel criticism of that he says that Senator Cassidy lied to him, it's getting a lot of traction all over the press, that pre-existing conditions are not covered here?
Well, everybody's got a critique, and clearly different people have different priorities as they approach this. And I'm not, privy to the conversations that have, that have gone on between Jimmy Kimmel and Bill Cassidy. But what I can tell you is Bill Cassidy has designed a plan that gives states maximum flexibility, but still requires that if a state is going to opt out of some of Obamacare's regulations, that it provide certify to the Department of Health and Human Services in Washington that there will be coverage, and adequate and affordable coverage, for people with pre-existing conditions. So the protections remain. And I think people who are suggesting otherwise perhaps don't fully understand this bill or how it works. But that's one of the requirements that Senators Cassidy and Graham and Heller and Johnson, who were involved with crafting this, wanted to make sure that we met. But it does give states more flexibility to come up again with solutions that better fit their populations. And philosophically and as a practical matter, we know that works. And I think we ought to give this an opportunity to see if this is the right solution, given the fact that the alternative is Bernie care, which is doubling down on more Washington control and ultimately leading down the path towards socialized medicine.
One last thing, a different topic, a story that's been reported and now confirmed that the RNC is paying some $400,000 of legal bills for President Trump in the legal bills associated with the Russia investigation. Should the RNC be paying that money?
Well, I don't know the legalities of that. I assume they're obviously, I think they probably have legal grounding and basis in order to do that. The wisdom of whether or not that's a good idea, I'll leave to others. But, obviously the president, because of all the attacks that are being leveled against him, has a lot of legal costs. And, obviously those have to be dealt with. But, the people who can support the RNC, I think, support the president. I think they support Republican ideals and principles. And the RNC will make, I think, good decisions about how best to use the resources that the Republicans around this country entrust them with.
Senator Thune, we appreciate your time.